Um, I think we can go ahead and get started. So welcome everyone. My name is Eliza and I'm a program specialist here at the Alaska Children's Trust. We're really excited to have
Tracy, I
Eliah
just want to turn yours
Anderson
up.
here today to discuss trauma-informed practices in rural school districts of Alaska. So just to introduce Eliah briefly, originally from Ketchikan, Eliah is passionate about studying how psychological supports for youth can be expanded within rural and remote communities. She recently completed a master's in school and applied child psychology from the University of British Columbia in Vancouver, Canada, and is now working on a PhD in school psychology at the University of North Carolina, Chapel Hill. Her future career goal is to become a licensed pediatric psychologist within the state of Alaska. When not studying, she enjoys spending time outdoors, fishing, hiking, or camping. So we are recording today's talk in case your internet is being funky, and we'll have that available later on the ACT website. So Eliah will be talking and then we'll reserve some time for questions. So when you're not asking a question, please keep yourself on mute. And if you have questions throughout, feel free to put them in the chat. We'll be monitoring that as well. All right, take it away, Eliah.
Great, thank you, Eliza. Like she shared, my name is Eliah Anderson, and this presentation is mainly based off my master's thesis, which was done at the University of British Columbia. So I'll be sharing more about the work that I did, some of the background, research and concepts, as well as then future work. But I would really love if there are questions, as I know this is a really kind of big topic and can be applied in lots of different fields. So also to share that given the master's and then now in a PhD program, that I am coming from this from a research perspective too, but very much love collaborating with teachers. And that's what a lot of my research is focusing on, is how can sort of the applied research and theory then be actually put into practice in both community and school settings. So I'll be talking for about 30 minutes or so about the research, but then if there are questions or discussion at the end, there'll be plenty of time for that. So to begin, I just wanted to do a land acknowledgement that most of this work was done while I was at UBC in Vancouver, Canada, and that was done on the traditional ancestral and unceded land of the Tsleil-Waututh, Squamish, and Musqueam nations, but that a lot of this work involved participants from the state of Alaska and where I'm from. And so as it was done throughout the whole state, I wanted to capture some of the main Indigenous groups from those regions. So in Southeast Alaska, the Tlingit, Haida, and Tsimshian nations. In South Central Alaska, the Yupik and Cupik. Interior Alaska, the Athabascans. Northern, the Nupiat and St. Lawrence Island Yupik. And then in Southwest Alaska, the Alatik and Unagaks. So first, I just wanted to take some time to talk about definitions, as sort of trauma and trauma-informed practices are words that can be used in many different ways. And in research, it's very important to have kind of very clear definitions of what you're studying. So trauma is a negative reaction to an adverse event. I think often in popular media or just in everyday conversation, you can hear the word trauma being used often as in relation to the adverse event, but really it's the reaction to the event, in which you have these long-term kind of negative, either psychological or emotional consequences to the event that was experienced. So this can explain how like two individuals can go through the same adverse event, but one may experience trauma and one may not. So we know that students who have been exposed to trauma have decreased academic performance, increased behaviors in school, as well as higher referrals for special education. And it's been well studied that sort of when in an aroused trauma state, students have a much harder time learning. So that is some of the background for why trauma-informed practices in schools are so important. So for prevalence, approximately 2/3 of children have experienced at least one traumatic event in their lifetime, though it's likely that this is much higher. We also know that in rural communities that there can be less access to mental health services, as well as higher rates of poverty or underfunded health systems. So we know basically there are high rates of trauma. Many children are experiencing trauma, and yet there's unmet need in providing children with the supports they need to kind of cope with these negative symptoms that they may be experiencing. So then looking at trauma-informed practices, I like to think of it as an umbrella term, and that really a trauma-informed practice is an intentional act that is being used within a system to try to create a trauma-informed system. So one leading definition by the Substance Abuse and Mental Health Administration defines a trauma-informed practice as a system or a trauma-informed system as understanding the widespread impact of trauma, recognizing the signs of traumatic exposure, having research-backed interventions that teach coping skills, and resisting re-traumatization. So within a school system, that means teachers, every single person that works in a school system, kind of having some basic understanding of what trauma is and how it can affect the individual. And it also means then beyond just recognizing it, then having access to the types of supports that can help the individuals and both students as well as teachers process some of these symptoms they may be experiencing. It also includes then being a safe and supportive environment so that students are able to go to school and not have to worry about experiencing trauma within the school system. So that's one leading definition, thinking about a trauma-informed system, that a more kind of research and recent conceptualization has been trauma-informed multi-tiered systems of support. So if you work in a school system or within special education in schools, you've probably seen this kind of pyramid before. And basically it's thinking about at the bottom, you have the school staff as well as school and community partnerships. And then tier 1 is all students, building up to tier 3, which are going to be the most intensive forms of supports. And those would be for students who have kind of clinical levels of PTSD, post-traumatic stress disorder, depression, or anxiety, sort of in relation to a traumatic event that they've experienced. So this is sort of one conceptualization that's gaining more popularity within the scientific literature, but that this project is mainly focusing on tier 1 and that sort of what are teachers doing within the classroom to support students. So that leads me, this was just a little bit of background in why did I do this project. And being that I don't have a background in education, I'm more from the psychology side of it, I was really curious to know, what did teachers think? So my research question was, what are teacher perspectives on trauma-informed practices in rural elementary schools? And so it was a very broad, open-ended question. And that was because I didn't want to come in sort of with these preconceived notions or theories, but really kind of start from the ground up. And so encompassing that, I asked questions about, what do teachers know about trauma-informed practices? What are kind of some of the strategies that they implement, as well as then what is some of the need that perhaps they see within schools. And just for definitions, the rule was defined as a community of less than 10,000, and then having a distance being over 100 kind of kilometers from a city of 50,000. And elementary school I looked at included kindergarten through 8th grade. So this slide, I won't go too much in depth since it's very kind of research heavy, but the main thing is that I had these 2 different data streams. So I did a survey, an online survey, and then I also did interviews with teachers. And so each of those data streams had a different data analysis. And then eventually I merged the results. And it was the kind of merging of the results and the combined interpretation that was able to gain a kind of more comprehensive understanding. So the survey was more of a surface level, just trying to understand a little bit more about what's being done, what do teachers think, while the interviews were much more personal. So I will start by just kind of going over the survey and then talk about the results, and then I'll go into the interviews. So the survey was an online survey, about 15 to 20 minutes. in Qualtrics software. So it's a mix of closed, open-ended, and then discussion questions. So asking things like, how on a scale of 1 to 10, how familiar are you with trauma-informed practices? How often do you use these practices in your classroom? Have you received training on this topic kind of in the past 5 years? Those kinds of questions. So a lot of Likert scales, but then also some opportunities for teachers to type in their own responses. And these survey questions were based off past research by Katarami, but then I modified it some to better fit the sample demographics of teachers. I did collect the survey from both rural and non-rural teachers. So there are 43 teachers from rural communities and then 45 from non-rural communities. And so from that, then I was able to do both some different types of analysis, which I will talk about a little more on the next slide. So looking at just the rural participants, here's some of the breakdown of the demographics. So they did kind of largely match the demographics of teachers in the state of Alaska. So they represented different geographical regions, with most being from South Central or Interior Alaska. Most of them identified as female, and then most identified as white alone. So here, two of the results that I present are very much just a snapshot, that it's a very long document that I was able to pull just what I thought were a few of the highlights. But in this, so from the descriptive results, rural teachers, 89% think that trauma-informed practices are very important to their role as an elementary educator. 63% regularly use trauma-informed practices within their classrooms, and that 88% think the COVID-19 pandemic increased the need for trauma-informed practices in schools, while 78% think that culture-responsive teaching is very important to supporting trauma-affected students. Then, so the next was comparing the responses of the rural teachers to the non-rural teachers. And so I thought this was really interesting in gathering a glimpse of how maybe rural teachers might be different in how they approach these practices versus teachers in more urban areas, basically like Anchorage or Juneau or Fairbanks. And so the kind of what I thought was more exciting is that this data shows that rural teachers actually can feel more confident in supporting students. And specifically, the rural teachers felt more confident recognizing signs of distress within students, knowing when a mental health referral is needed, accessing trauma-specific supports for students and their families, as well as discussing the topic of trauma with their parents. So kind of given the small sample size of this study and just the fact that it was a master's thesis, these results are definitely kind of seen as exploratory, but I think are kind of an exciting finding in that rural teachers, highlighting some of the strengths that rural teachers in schools have in supporting students who have been affected or may be affected by trauma. So next, I will talk about the interviews. So I did semi-structured interviews. So I had set questions that were largely very similar to the survey that was sent out, but allowed me to get a much deeper insight into what teachers think, and then maybe some of how they act in trying to both identify and support students affected by trauma within their classrooms. So there were 6 elementary school teachers in rural Alaska. The interviews were conducted over Zoom and lasted about an hour to an hour and a half in length. And so I would do the interviews and record them, and then I would look at the transcript and then upload the transcript into a software. And based on looking at the text, I would try to code it for meeting. And so I had lots of different codes, and then from the codes would try to match them together to create themes. So from these interviews, there are 4 main themes as well as 16 sub-themes. And so I don't have time. I'll mainly be focusing on the main themes, but just touch on some of the sub-themes. So the main themes, though, were student needs, the role of the teacher, the school system, and then the uniqueness of rural communities. So here's a snapshot of the interview participants. The names are pseudonyms just to protect their identity. But again, it's mainly female. There's a wide range of teaching experience from 5 years to 24 years, as well as then many of these teachers have taught in several schools within Alaska. And then the size of communities range from under 1,000 people to near 10,000. And so this graphic is sort of highlighting all of the themes together. So I know it might be hard to read some of the sub-themes, but mainly highlighting that. So in bold is the main theme, and then the sub-themes would be below that, but mainly trying to highlight that each of these themes are best understood in relation to the others. So to understand student needs, you also have to understand the role of teacher, school system, and then the community context. So looking at the first theme, student needs, this theme encompasses sort of is what the teachers talked about in answering the question, what do trauma-affected students need from teachers in the school system? So it included teachers talking about the wide range of traumatic events that students were exposed to. This included the teachers talked about many things, including students talking about parental death, due to drug overdose, domestic kind of violence or abuse in the home setting, food insecurity. There's a wide range. It also talked about teachers' views of wanting school to be a safe and supportive space for the students, as well as the individuality of student processing the trauma. So that mainly included that some students were very externalized in how they process trauma and would have loud, disruptive interruptions in the classroom, where some students then would become really withdrawn. And so for each of these, there are lots of themes sort of within the actual thesis, but for this presentation, just included one quote. And so this teacher, Greg, is saying that we need the students to know when they come into the building, it's a safe place. They're safe. They're going to have safe interactions with their peers. They're going to have safe interactions with the staff. They're going to have people who care about them and identify them as an individual. So then the next theme was talking about the role of the teacher. So beyond just identifying sort of the needs of their students, what are teachers doing to support trauma-affected students? And so it included things like meeting their academic, but also beyond just academics, social, emotional, and physical needs of students, both inside and outside of the school. So several, if you've ever kind of lived or been in rural communities, you know just the closeness of that many communities have, and that these students know teachers outside of school. And so several teachers talked about how the students would go to them for support even outside of the school day. So included like students knocking on a teacher's door saying, like, I'm hungry, do you have any food? And so that's a very big difference in a rural versus a larger, more urban setting. It also included teachers managing trauma-related classroom behaviors, which I talked about sometimes were externalized, such as like a tantrum, versus other times students just becoming very withdrawn. It also included teacher well-being. So many of the teachers talked about the just high level of care that they had for their students, and sort of when their students struggled, and especially when the teachers felt limited in their capacity to support students, that really took a high emotional toll on their own well-being. And then teachers' desire for applied training and support in better supporting their students. And so this quote is just sort of a snapshot of one story from the interviews, in which Marcia was teaching second grade, and she noticed a student just being more withdrawn. And so she just went up to the student and asked him how he was doing. And upon asking that, she said he started to cry. And so we got down to it. He needed help cutting his fingernails, and he didn't know how. So I said, okay, we can cut your nails. And of course, I have nail clippers on my desk because we all do. And so we cut his fingernails, and I showed him how. We talked about it, but it just broke my heart because he said, my mom always did it. My mom would cut my nails. Those kids never got counseling. They never had, any support to work through that process. And just background to the story too, this was a student whose mother had died of a drug overdose a little bit earlier. And so was saying that, anyway, important to understanding this quote of the teacher being a primary source of support for the student in processing this large emotional traumatic experience. as well as then the teacher acknowledging that this student probably does need more support than what kind of they could provide, but doing the best they could in that moment. So then theme 3 is looking at the school system as a whole, and basically thinking about how these different components of the school system work together to support students affected by trauma. So it included teachers talking about the importance of having administrative support, the importance of school-based mental health professionals when teachers, like in that previous story, are recognizing that this student is needing more than what they can provide, having a counselor or a psychologist to refer to. The importance of balancing communication versus confidentiality. So knowing that if a student discloses information, knowing that that's private and that information should not escape the school system, while also needing to talk about trauma. The teacher's saying how it's helpful to know, obviously, what maybe a child is going through. And then the kind of some of the tension in between balancing academic versus the social emotional needs of their students. And so one quote from this section was Sheila, and I was talking about the importance of administrative support. So she said, yeah, it would have to come from the top down, because if we're not supported by like our vice principal and our principal and using these kinds of strategies, or just even colleagues, if there's no buy-in, then it's not going to happen at our level. And then finally, this last theme is looking at the uniqueness of rural communities. And so thinking about how does this rural community context impact school and teachers' ability to support trauma-affected students. And this theme I thought was really interesting, and that there were some aspects that were maybe that teachers felt were harder for them in supporting students, but also some strengths as well. So it includes community closeness. So teachers being able to know the students better, know maybe the students' parents or grandparents. It includes a rich local culture. It also included several teachers talking about the impact of generational trauma and colonialization, as well as then limited community supports. And this quote I picked because it kind of highlights maybe some of the challenges that the rural schools face, but that there are also many strengths kind of within that space. So Greg is saying, we may not have a school counselor, but we still have a community of educators that would get together and meet. And we also have a community of leaders, usually elders and leaders within the community, that could also be part of that in whatever capacity that we would need. So lastly, just here's to kind of bring all of the themes together from the interviews. And again, it's helpful to understand one, it's best kind of to think about it in this larger context. So then thinking about both the survey and the interviews and sort of what does this all mean? Teachers in rural Alaska are an important source of support for trauma-affected students. Many of the rural teachers felt fairly confident in implementing trauma-informed practices, but yet still expressed the need for increased resources and support. Teachers felt were better able to support trauma-affected students sort of when their efforts aligned with larger school system practices. So this often meant admin support, but also access to a school counselor or like psychologist. And that rural schools have unique strengths in supporting trauma-affected students. So such as community closeness, and then kind of a rich local culture were two of those main strengths. So then sort of if this is what at least this study found, how can this be applied within school and community settings? I think one of the biggest takeaways is that no one size fits all. So it works. In research, we love to make these really big, broad, generalized statements in all schools, and especially rural communities. No one size fits all. So it works for, and even often in research, there's a rural versus urban divide, but we know that rural communities are so different from each other. What works in Southeast Alaska might be different than South Central versus Northern. So really it's trying to learn more about that local school and the strengths that they have in maximizing the strengths. Meeting students' basic physical and mental health needs. that rural schools may not have access to some of the more advanced supports, such as the counselors. Many of the teachers talked about how they would love to have a school counselor, but didn't. But that the research shows that meeting the basic physical and mental health needs, as well as having positive relationships within the schools, can be just as important to supporting students as maybe time with a counselor. Also, I think there's a lot more opportunity, or a lot of opportunity. I know there's a lot of work already being done collaborating with community organizations, as well as then having trauma-informed resources specific to local culture. And I would say from an Indigenous perspective, that there are a lot of sort of trauma-informed curriculums that are out there, but that many of them aren't taking into account differences between Western views of trauma versus an Indigenous perspective. As then greater local cultural integration within schools that several of the teachers talked about, how they themselves identified as white or were not necessarily local to the culture. And so how that it was harder for them to teach about, and it was harder and necessarily didn't feel right about teaching about Indigenous culture in their classrooms, but yet still felt it was important in supporting overall student well-being. And then greater training for teachers, staff, and school leaders, both in recognizing signs of trauma within students and themselves, as well as then greater access to coping tools and resources available. So, and knowing that, again, rural communities maybe have less access to some of these professionalized supports, there are different areas that could be pursued, such as like telepsychology, or kind of online programs that maybe could help fill that void. So that actually transitions to the next slide, which is thinking about what maybe for future research or community work can be done. So I think one of the biggest is just learning more about increased universal wellness. So how do we make schools a safe, positive, fun environment, both for students, but also teachers, as we know that this is a major factor in supporting trauma-affected students. Then greater training and resources for teachers and staff. So recognizing trauma, connecting students to community resources, as well as teacher and staff self-care, increased cultural competency. I think I touched on that. And then, so tier 2 or 3, which is those targeted interventions that have access, that are specific to rural communities and accessible. So it could include like telepsychology, that if a school doesn't have access to a school counselor, could they go to a classroom and Zoom a counselor? Or is there a community resource nearby? That one of the teachers was talking about a community elder, or is there someone in the community that they could go to talk to? As well as then universal screening for trauma is very loaded, but there's some work being done on how can schools better identify students who may be affected by trauma. And the idea follows that if you identify kind of the symptoms of trauma sooner, then you may be able to more quickly provide support. So this is all kind of future work that is in way or can be done in relation to this topic. So that is sort of the end of my formal presentation, but if people have questions or comments, I would love to have more of a conversation on how these ideas can be applied kind of within rural school and community settings, or thoughts that the audience may have.
Thank you so much, Eliah. Everyone feel free to put your questions in the chat or unmute yourself and ask. And it looks like we have quite a few folks here from rural school districts, so that should be the start of a great conversation.
So one question I could just ask too, if is that then what efforts do you see in your school to support students who may be affected by trauma, and then your thoughts on like maybe some positives of what's working or what could be improved upon. If anybody is feeling brave on their lunch break.
Hello, this is Will with Boys and Girls Clubs, and we hopped on You were talking in terms of school districts, but really one of the things that we're working on as Boys and Girls Club statewide is through some processes that Boys and Girls Clubs of America developed around being a trauma-informed organization. So we know that a lot of good work has really started and gotten a toehold in a lot of school districts. There's certainly a lot more good work to go, but we're also trying to, there are just so many gaps in the community, right? And with community-based services and being able to be responsive to children who have experienced trauma. So part of it is we're kind of in the mix too. So really have appreciated your presentation today, and a lot of what you talk about in the school context really resonates in the out of school context.
Mm-hmm. Yeah, and that's something I'm still a researcher, but working on becoming kind of a licensed psychologist, and something I'm very passionate about is trying to better connect these different areas of service and support kind of within communities, because often they can be very kind of siloed if you have schools or and so more kind of increased conversation between these different areas of support.
Hi, this is Linda Faber. I'm with the Boys and Girls Club also. My voice is gone today, so I'm trying to make it brief, and I hope you can understand me. As piggybacking off of Will, we have started to become a trauma-informed organization as a whole, and I've started in the Southeast region, my clubhouses, we are going through the trainings right now for that. But like in a few of our clubhouses, we do work with the school districts, and some of our programs are in the school. So just the fact of everybody getting on the same page and teaching each other in the rural villages as we go is like super exciting. This pairs very well with what we do anyway. And as you know, like in our small areas, it does take a village, and we all know each other. And like it brought tears to my eyes because I've had almost the same story of a little kid that didn't know how to cut their nails, like almost to the T, or that, I don't have enough food. Do you have any? And it's like, where do we draw a line? But then of course we want to feed them if they're, right in front of you too. So, I mean, there's so many different challenges, but I appreciate this. Thanks for inviting me. I'm going to stop talking before my voice goes again.
Yeah, thanks for sharing. I think, and something that came up sort of within this project, but also I'd imagine presentation as well, as we are all people that know the importance of supporting trauma affected students, but that it's often translating this information or sharing it with the policymakers, or sort of the areas of sources of funding, so that that basically you all, or the teachers that I was talking with, can do the work and support that they want to do. And so that's something that I'm always thinking about, is how do you take the research and the findings and share it with the people then who can sort of change the system for the better.
I have a question. I work in the Haines School District, and then I also support the IDA, but I've worked in a lot of districts around Southeast. And I wonder if there's an effort to use the developmental screening events to identify like children who may need additional mental health resources, or if that might be sort of a way to just, often when we do those developmental screenings, we start with like the ages and stages questionnaire for the parents. And I wonder if we just added like a little thing on like, is there anything we should know? Or, I don't know if there's like a child version of the ACEs questionnaire, or like a parent version where they can sort of report for a younger child, but it seems like that's how we identify special education needs, hearing, vision, that kind of thing. I wonder if we could sort of, implement it in that process, because it's a district mandate that they have to do those every year. And often, like in our communities, it's often like parents as teachers and infant learning and the district and public health. And sometimes the health providers are participating in that and sometimes not. But I just think if we maybe identify, because like you're saying, part of funding things is like, how much need do we have? And I think post-pandemic, some of those screenings either didn't happen, or people are sort of just now getting back to where they're running those screenings more efficiently. So it just makes me wonder if like identifying how many students have needs in those areas might help us sort of justify the funding, or if that's already something that's in the works as far as identifying students for trauma. And because we all know that they're out there, but you know, in the short of having a mental health provider in our school, which our school did add sort of a mental health specific counselor on top of the regular school counselor, who usually in a rural area, you know, they're called a counselor, but really they're like, here's your classes and what's the next step and that kind of thing. And so it's not really like a mental health support for students. So our district has kept our provider on past, like, I think when they had a COVID related grant or something, and they found a way to fund it. It's made a huge difference in our school to just have somebody right there that has those skills and has the training. And then they do a lot of like intervention within the classrooms. They, you know, they're talking to all the K-8 students, I think sometimes at the high school, but not very frequently. But I just wonder if there's like an identification piece that's already happening statewide, or if we can roll that in somewhere to an existing process.
Yeah, I mean, yeah, you brought up a lot of really good ideas, interesting topics. There is work being done on early identification, and so yes, there are screenings available. Like the ACE is obviously the most well-known one. So for those who aren't familiar, the Adverse Child Experiences Survey, and that it was done actually by an MD who was working in kind of a medical clinic and seeing a lot of patients not following through with treatment. And so that led him to literally call them and ask, hey, what's going on? And found this theme of childhood trauma. And so was able to kind of connect, look at the numbers and say that if you've experienced childhood trauma, that a lot of this compounds. And so that sort of the greater adversity you've experienced in childhood can impact sort of outcomes for life, like heart disease, rates of certain cancers, even life expectancy. And so that was one of the first studies that was done that created a lot of this later research on trauma. So the ACEs study, and then yes, there have been ones designed for children. There have also been some studies that have looked at that, asking parents about their child. So their children is another possible way of doing it. Okay. But that basically one of the challenges with this is confidentiality. And so the infrastructure of a school system isn't necessarily set up to maybe house such personal or sensitive information. That like there's FERPA, there's like the educational privacy laws, and then there's HIPAA, the medical privacy laws, and they're not really set up in a way for school to necessarily house like what you would say is more personal, like medical information. And so I think there is, I can speak to the research side. I don't really know the practical side as well of what states are trying to do to combat this. But that I know there are states trying and saying, yes, universal screening for trauma would be great. And they've shown that it does work, just like you think that the earlier you're able to identify it, the better outcomes there are later in life for that child with the appropriate treatment. I think just the problem is there's a lot of fear about how that information is going to be stored, and maybe more again from a legal perspective of schools don't typically maintain that type of information in the same way. And that came up too in the interviews of some of the teachers were frustrated maybe not knowing what the children in their classroom have gone through, saying, well, of course, like I want to know. One of them was saying they found out like that there was a drug bust the night before some test. And of course the student didn't do as well. And so the teacher said, well, of course, like I would have changed my expectations of this student. I would have approached the situation very differently had I known. And so that came up, both sides of it, wanting to protect student privacy, and sort of knowing that what gets talked about in a meeting or a school lunchroom, you don't want that to leave the school. But then also the importance of like, of course, I can be a better teacher if I've known that maybe this student is actively kind of having a traumatic response. And so the difficulty of how to balance both of those things. So I think it's very much, hopefully that it will be figured out, but right now, it's not really at that widespread level yet. So, but I do think too, like in school psychology, I work a lot in special education and IEP meetings and 504 plans. Like I would love to see like a 504 plan for a student who maybe is affected by trauma or kind of actively experiencing some of those symptoms. And it doesn't necessarily mean that that 504 plan has to be with a student their whole education careers, but in that moment, you know, some type of way to get them extra supports.
I absolutely agree. I think I have a really hard time advocating for IEPs at all for students with mental health challenges or that don't have, you know, there's either a reluctance to evaluate the educational impact of that. There's this like, oh, they're doing fine academically, so we don't need to get involved. And that's absolutely not what IDEA law or 504 law says is the rule. That's sort of like an interpretation. And then if they are, because school refusal is a huge issue for kids that have experienced trauma or that have anxiety or other mental health conditions. And so, yeah, it's going to impact their education if they can't get into the building, but the people in the building never see that sort of battle with the parents to try to get them to go. And so I find that Alaska, compared with, I used to work in Oregon, just doesn't really have a handle on like, how do we write an IEP for a kid who's experienced trauma or a 504, or what diagnosis do we use, or how do we follow those rules? And I think it's absolutely possible. It just hasn't really been done in a widespread way. So people aren't really very comfortable with it, especially admin, you know, they're sort of like, oh, well, that's not a learning disability thing. That's not and it's like, well, if it's impacting their education, then yes, we're supposed to act whether or not it's academic. So I find that sort of a culture shift that we maybe need to push for a little bit more in Alaska.
Yeah. And I can say it is now, like I'm at UNC in North Carolina and have worked in schools in different states and even in Canada and in the US, that I can say it's very much just not an Alaska like issue, that schools very much are traditionally seen as academic institutions, and like there's still that perspective is very prevalent. And so but then yet there's all this research and work being done showing that, oh, when students are cared for holistically, their academics improve. And so I think we're kind of in this tidal shift of even a broader discussion of what's the role of schools and what's the role of special education within schools. And so I think, like, I see of a lot of good work that's being done more, but I think it can vary a lot per school, per district. And like you're saying, it often rests on admin views of what can be done. So I do know too, like I've gone to some conferences and trainings where they are even advocating for a trauma section as part of IDEA. So I know there are a lot of people behind the scenes who kind of share similarly, or even in the DSM, there's not really a trauma. So from the clinical side, there's not really a trauma diagnosis. Like there's PTSD, but that was the creation of that came from adults, and really more adults who had been at war, veterans. And so there is work too in the DSM of trying to create a category that better captures childhood trauma. And so I'd like to think it's a domino effect of kind of when one system recognizes it and sees it, that it can translate. But of course, it takes many years for that.
Yeah, I do think we're lucky in some ways in Alaska versus other states, because we have that early childhood developmental delay category until they're 9. Like most often a child who has trauma, if we evaluate for social emotional, we're going to find, you know, or adaptive is usually where that pops up. And so, you know, we can use that category. But speaking to the DSM 4 thing or 5 thing, like when they reauthorized that, everybody was hoping that sensory processing would become, you know, a category that we could use for eligibility rather than having to sort of label them ADHD or something that might not be the problem to get those services. So I do think if we, you know, maybe that's the way that we sort of start to change this a little bit, is just to say, yes, there's a social emotional delay related to the trauma, that we can use that category at least until they're 9. And if we identify them early enough, hopefully we've done our job and we exit them at that point rather than needing to find a different category if there isn't one, if that makes sense.
Yeah. And there's a lot of overlap there too. I think there's a lot of potential. I mean, the special education system does a lot of great work in supporting students kind of with different needs. So I think there's a lot of potential in thinking about how students with trauma can be better supported within that system. But I do think there's a lot of factors. It's a complex issue, and so there's a lot that goes into it. But very interesting to think about, and something that I very much will be thinking about throughout my career. And so always enjoy the opportunity to talk about it.
Eliah, I'm wondering if in any of your interviews or survey responses, the theme of teacher turnover was talked about at all, because I know that we struggle with that in Alaska. And I noticed in the teachers who you interviewed, I think the shortest that someone had been teaching was 5 years, which is still a decent amount of time. It's a time to build up sort of that understanding of trauma, but also thinking about what you said about the importance of community integration in rural schools for teachers who, you know, haven't lived there a long time and maybe are not planning to make that a permanent home. I could see that being a potential issue for them to really draw on that community integration the same way a teacher who has lived there their whole life or has really built a strong base of support in that community might be able to do.
Yeah, definitely. It came up, but not enough for it necessarily to be like one of those big themes. Like, I think that was something that maybe I thought I would see more. And there are a lot of reasons for that I only talked to six teachers out of the thousands that teach in rural Alaska. So some of it's dependent on what they brought up. And so maybe because they all had been teachers for longer, they really highlighted the importance of knowing their students, as well as knowing other teachers, knowing the administrators. Several of the teachers talked about that, how great it was that if like their student was struggling, they could call the student's grandma and say, hey, like, is anything going on? And so that was a positive. That also could be a downside if sometimes the teachers would call parents and then realize, oh, the parents are struggling with their own difficulties too. So that definitely came up. I think it came up probably more in the survey, with some people just saying staff turnover as well as staff burnout, that this was done during kind of the tail end of COVID, the survey. And so many of the teachers talked about too, how when sort of if there are efforts to better support these students, it's just another responsibility on the teachers' sort of to-do list. And so they're like, well, yes, many of them are like, we want to support students, but who's going to support us in those efforts? And like, we already have so many things to do during a school day that this is kind of one more thing on top of that. So yeah, it didn't come up directly, but I think you're right, and that's a very important issue. And maybe more in this project, it came up the opposite, to say, when we have been in a school district for a while, it really helps us do our job as teachers and in supporting students with trauma. But yeah, so I could imagine it's important, but didn't have maybe the data specifically within this project on that. So, and that came up too. I thought that was really encouraging, is that, again, there's like counseling and there are these specific strategies that you can use, but just the impact of a positive relationship with a student can be just as impactful in supporting the student. And so I think that's a message that could get shared over and over, is like, don't discredit the work that you are doing. Maybe that it's not quite as evidence-based or like, there's always room to improve, but just being that safe person in a student's life can have a great impact in supporting their future.
Definitely. Yeah, at ACT, we've gotten really interested in the flip side of ACEs, those positive childhood experiences, and really digging into that research on the huge mental health benefits that having those supportive relationships can bring.
Yeah, and it's sort of like there's a lot of work that's ultimately, I think, ends up being very similar, whether you focus on, you want to call it trauma and sort of the others, or the supportive and sort of those like post-traumatic growth, and even just the field of positive psychology and resilience, that they operate under different terms, but I see them very much as two sides to the same coin, and for sure.
So we've got about 7 minutes left in our hour. Does anyone else have questions or comments?
If no one else has a question, I was curious, Eliah, you had talked about this just now when you're responding to Eliza, but I'm curious if in your survey, when you were talking to the teachers, if you got to hear examples of like positive ways that school districts and administrators are supporting teachers in their well-being and like trauma-informed practices among staff. So like, yeah, like good things that are happening, and maybe the flip side, like what do teachers wish that they had from their administration?
Yeah, I think I definitely heard both sides, and that was sort of hard to capture, is that some teachers were saying, we are doing great, and like, I wouldn't change anything. And then others saying like, I've been like struggling with the administration for years, trying to get more support. And that's why I think kind of ultimately it's sort of, well, it's like, what should we do? Well, I think it depends on the school and the district and like what's already being done. But yeah, and then also it was during COVID. So some talked about how maybe they had these great strategies or practices or trainings in place, then that kind of fell apart during the pandemic. And so they were hoping that it would restart again. So some talked about training that they had done that was helpful. I think one of the more helpful strategies was having meetings. So kind of like an IEP or 504 meeting where several teachers could get together and then talk about how the student could best be supported. And so I heard of that strategy. The biggest one was probably also having access to a school counselor. So teachers saying that they notice something in the classroom and they're able to refer to someone, or even if they're not able to, even if the student maybe chooses not to have an individual session, the teacher can talk to that licensed mental health professional and say, did I do the right thing? Like, what could I try differently? So I also, like, I'm in the mental health profession, but always advocate and kind of see the importance of that, because teachers, that's not necessarily in their training, that I think obviously they learn a lot about supporting holistic childhood development in the job. But having that specific training is vital. Yeah, another thing that teachers talked about was being able to have a support group within a school community. And so that was more for the emotional support, but just saying how I was impressed just with so many of the teachers and how deeply they cared for their students. And so being able to go to the lunchroom and talk with fellow teachers sort of about some of just their experiences, what they're seeing, what they're doing, and able to feel some camaraderie and emotional support that way. I think they talked about how helpful that was. And then, sorry, the second part of the question was then what kind of maybe could be what teachers wanted to see done. A lot talked about applied training, that they maybe have sat down and watched online videos, or read books and things, or read a list of strategies, but then actually taking those ideas and translating them into like an everyday classroom setting. So one of them was saying, oh, I wish I could have somebody come into my classroom for the day and just kind of watch and then point out little things here or there that I could be doing differently. Another was saying, oh, several of the elementary school teachers talked about just these very explosive behaviors, kind of like kids throwing things, throwing chairs, kind of putting other students at risk of harm. And so saying, oh, I wish I had someone I could call up and kind of respond, like knowing that this behavior is kind of a trauma response, but not feeling equipped in the moment how to handle that. So a lot of it was more the application of wanting someone, a resource that they could talk to that could come into the classroom or just provide the teachers with support. But a lot of it too, I think the teachers who were in school districts who felt supported by their admin and or had access to a mental health professional felt much better than the teachers who didn't. And so I think that was really telling. and something that could be improved upon, of course, in the districts that don't have access or support. But that is a good question.
Well, thank you so much for being here. Are you planning to expand on this research at all in your PhD or publish it in any way? We'd love to follow your
I
work.
would like to publish it. It's a little bit hard in that this was a master's program and I'm now in a different university. So yes, I'm kind of working on it and would love to continue it for my dissertation. I guess I could put a plug out that it really helps to have connections that kind of coming in from the academic side, I'm always looking for groups to like partner with. So that would shape a lot of the dissertation if having a good partnership. But yes, very much interested in it and would love to move back to Alaska one day and kind of keep working in these areas. So, and thank you very much for having me and all those attending.
Yeah, it was so interesting. I feel like I've learned a lot. So thank you all so much for being here. And again, we will be posting this on our website. So if any of you have colleagues who would like to watch, it will be available for them.
All right.